Hello and welcome to Skin News. I'm Joshua Fox, board certified dermatologist at the Miami Center for Dermatology. Today we'll be discussing a paper in the Journal of the American Medical Association Dermatology that was published electronically in October 27th, 2021, so it's pretty hot off the press. The lead author is Mohsen Afarideh out of Mayo Clinic, which is a pretty big dermatologic center. And they were looking at an association of sun protective behaviors with fracture and bone mineral density. So just a quick bit of background. The skin plays an active role in the synthesis of vitamin D, and vitamin D plays a role in a number of factors in the body, and one of the roles of vitamin D is involved with calcium absorption and bone health. So the thinking is that if you block vitamin D production by the skin, which comes from UV exposure on the skin, you might have low vitamin D levels, and then therefore your bones might be at risk for fractures or at least having a lower bone mineral density. So this paper, in this study, they looked at patients' sun protective behavior to see if there was an association between sun protective behaviors and fracture risk, because that's really what we're concerned about. Are people getting fractures from having lower vitamin D levels and therefore having lower bone mineral density and therefore being at risk for fractures? So what they did was they used a registry of patients, about 3,400 patients ages 20 years and above, and they asked them a number of questions about sun protective behavior. That is, for example, how likely are they to stay in the shade, to wear long sleeves, to apply sunscreen, and so on. And then they looked at those patients' bone mineral density scores, which is a way of measuring their bone mineral density. And they also looked at whether they had an osteoporotic fracture, right? That's a fracture from osteoporosis or having a low mineral density. And of the 3,418 patients, the average age was actually about 40, which is relatively low when you think about osteoporosis. But as far as the prevalence, that is, how many of the people answered the sun protective behavior scores, so about 32% said that they were staying in the shade, and 12% said they were wearing long sleeves, and 26% said they were wearing sunscreen on a frequent basis. So when they looked at their survey results as far as using sun protective behavior, they then compared that to how likely they were to have a lower bone mineral density score or have an osteoporotic fracture. And they found that there was no association between patients who were having good sun protective behavior and having fracture risk. Therefore, what they concluded from the study was that although patients were having less UV exposure with their good sun protective behavior, they did not have an elevated osteoporotic fracture risk, and they also did not have lower bone mineral density scores. In fact, interestingly, what they did find was that patients that said they stayed out of the sun moderately to frequently, that they stayed in the shade, they found they actually had a lower prevalence of spinal fractures. It's possible that just could be that they're not doing maybe high-risk activities or things of that sort. So basically the bottom line of the study is that looking at about 3,400 patients, they found no association between sun protective behavior and osteoporotic fracture risk, which is what we're concerned about when we think about decreasing vitamin D. Now, there actually have been other studies that looked at sunscreen use in vitamin D production, and they actually found that using sunscreen did not lower vitamin D production, and that probably could be because people aren't maybe not using as much sunscreen as would be necessary to completely block the UV exposure to the skin, and therefore there still is some vitamin D production. One thing I want to point out here is that like I said, the average age of the study was about 40 years old, which is somewhat young if you're trying to find osteoporotic fractures or lower bone mineral density. But nonetheless, they did not find an association, so we in dermatology still recommend patients to use sunscreen and perform sun protective behaviors. And this study is good evidence that demonstrates that in doing so, you still will not have an elevated risk of bone osteoporotic fractures. I think I'll probably make a video regarding sunscreen, how much to use, and so on in the near future. Stay tuned for that. Otherwise, great to see you. And remember, dermatology is more than skin deep. Take care.